reality for this kind of thing, and for our work in Haiti now 25 years, is that big government questions, coup d'etats and corruptions and that kind of stuff, don't necessarily penetrate the level of folks we work with. So the Ministry of Health has technically changed hands 10 different times since I've been working in Haiti, but we've worked with each one of those partners, and the priorities to provide better vaccinations and safer delivery and more antibiotics or whatever, that stuff stays pretty level. And so even with the shake of this new government and some uncertainty about where it goes economically and politically, the health stuff is just barging ahead faster than it could possibly go. I think the other important, or another thoughtful way to think about that question is, are you, in making an assessment like this, and we'll all hopefully be faced with them if we work out in the world and get a chance to be in far-flung places, including Englewood or other spots. Is the spirit of the question, what's my way to get out of this, or how am I going to solve the problem? And often the question of, is a government corrupt? Can we trust them? It's just a way to back out and say we're not going to collaborate and we're going to retain control. So I think the spirit of the question, not that you have a spirit in your question, but as an organization or as a policy, what are you trying to do with that question? Are you trying to solve it and figure out the best way to work with the actual authority in the place, not you as some foreigner, but the actual authority that exists? Or are you looking for your out? And we can usually find an out. That's not so hard. But it's also potentially as easy to move forward. And then there's all these other benefits for stability. So it's an open question. But I think we feel really confident around the health side. In large politics, it's beyond us. Yeah.
I don't mean to follow up on
those
discussions, but I said,
yeah.
I was curious about the work you mentioned. You showed the world map and how you've partnered with health has branched out to other areas. Kind of along that same lines of getting involved and not pulling out instead of actually finding new ways to get involved. There was a question about the states earlier, and then other ways around the world. Do the partnerships, is the same model applicable in all places? Based on governments, you mentioned the Ministry of Health. I assume that every government around the world is looking for ways to try to find ways to improve the health of their people. But is it a different sort of model when you are moving around the world doing these things?
Yeah, that's a great question. There's a little bit of luck and just relationship that sets priorities for where partners in health goes. But like Rwanda, that was at the insistence and the invitation of the Rwandan government with some funding that was in place through Clinton's juggernaut, and so that was a setup for success. The government wanted us there to do a technical thing to provide healthcare in rural places. Peru started out as an opposition to a government program that was not functioning, but now it's been completely turned over to government functioning. So yeah, I think the principle of collaboration definitely cuts across, and then a lot of the technical work is pretty similar. Medicine's kind of medicine in most contexts, but providing a new technique and technology to deliver on the ground and provide home-based care and that kind of stuff. It works in the States, it works in Malawi, it works probably anywhere you put it as long as you get good collaboration and find your way in. One of the most exciting small projects for us now is in the Navajo Arab region, and so a collaboration between Partners in Health and the Indian Health Service, which is not a simple organization on any level, both historically and currently, but the Navajo Nation as well. So there's another government. The Navajo government is its own sovereign government, and they have a community health worker system that we're advising and collaborating with around diabetes and heart disease, kidney failure, these kind of chronic illnesses that are the problem in that region as opposed to TB or whatever the other thing might be. So I think it's at least, it's like, I'm a hammer and everything's a nail, but I think these techniques can work most anywhere. I think they would have worked in Alabama, but I got cut short there. Yeah.
So many of these diseases you refer to, diabetes, heart disease, so much of it can be prevented, part of it can also be diet. How much is organic farming happening in Haiti, and do you have any role in that?
Organic farming is happening 100% of the time in Haiti because there's no chemicals and pesticides. So hunger is still a big deal, you know, and nutrition is still a big deal, but that's actually a growth potential. There are people growing really high quality coffee and other things for export, vanilla beans and stuff like that. PIH has had for a number of years agricultural, you know, kind of collaborations, tool banks, you know, just ways to lend tools and provide capacity that way, seed banks to do that kind of stuff. The biggest thing we've got going now is a farm of pretty reasonable size, 20, 25 acres or so, that's focused in large part on producing peanuts that can be made into high density protein, what gets called plumpy nut in the medical literature. That's unfortunately a brand name, so you can't use it. But we're producing enough of this peanut nutrition to feed our patients and starting to spread it around the country. And Abbott, which is a local pharmaceutical, has just committed to building a full-size production facility in central Haiti that will, you know, be able to make this stuff on an industrial scale and provide some jobs and stabilize. So there are a few things like that. It is, though, kind of job one. I mean, the amount of undernutrition and frank malnutrition is staggering. You know, an hour and a half from Miami, it's really off the wall, but approachable and solvable. Is that may not be the spirit of your question, but
Well,
that's what we're up to. Yeah.
Well, to me, it just seems if you can crack that nut, literally, figuratively, a lot of your problems could also be solved.
Absolutely.
And so I know there's an intimate link here. Just kind of like food deserts exist in Inglewood and neighborhoods like that. That if we can solve that problem, you can solve a lot of the medical problems as well as education problems. That how can you expect a student to compete with a Nutrier or, you know, other Naperville, if they don't even have 3 square meals, or if a meal is considered a bag of Doritos and a Diet Coke? You know, that really isn't fair that you can expect them to get, you know, high scores in GPAs and whatnot.
Yeah. Thanks. Another thought?
I have a question. How could students get involved with some of the things you're doing in Haiti? Pre-med students,
Yeah.
medical
Right.
residencies.
I think that the first thing to do is just know more about it and you know, talk about the issues and you know, be a good student of these issues, of these problems of the region. And the Caribbean's a fascinating place. It's right at our doorstep. Hopefully you'll get a chance to go. I think going as a student is a great thing to do, especially if you accept that you're not a medical person and you go as a student and go as someone who's just there to learn language or to meet people. And I could, like, you know, again for myself, I couldn't have told you I speak this language for 15 years and live and work in Haiti so frequently from the tiny town I grew up in Pennsylvania. And you know, I couldn't have connected those dots, but by showing up, they got connected. So I think, you know, learning and showing up, and I think one of the best things at this age, student stage, before you become professionalized in whatever you choose to do, is to organize. You know, pick an issue or a way of working, either through a church-based organization or through something else or something else and something else. Almost not irregardless of the goal, but so that you're working with other people on a problem that you're thinking about solving. And I think, honestly, as I'm circling back to this new part of my career, I think that's almost more important to me now than my technical medical education or the bits I've learned about human rights law. Really, the ability to make collaboration, to organize, to do just kind of basic coordinating. I think that's as crucial as anything else. At least that's what my days are spent doing, and that's what I like the best. So maybe getting an early start would get you there faster than me. That seemed like a little answer. And let yourself be a student. I mean, I respect the question, and I hear it just week after week. You know, I want to go and do something medical because I'm going to be a doctor. If you go and it's not the right question to ask when you're a pre-medical person. Anything you do to get out in the world, to see its complexity.